education, information, and a bit of humor, and not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Introducing Jolly's Pharmacy, brand new website, www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.gm. Jollies Pharmacy, leading the way in healthcare.
And I agree with that. I would say that we are leading the way in healthcare. Good morning to you. I am blowing my trumpet, I know that. But it's a pleasure being here with you this morning for yet another episode of Health Vibes, brought to you by the brand you trust the most, Jolly's Pharmacy. It's a beautiful day on the outside. I know many of us, we may have been getting a little tired with the rain, consistent rain these past maybe 2 weeks. And today it's a beautiful sunny day. There are many people who are really happy to have the sun outside, to get those clothes dried properly, and to get some chores done, to get some construction done, to get some farming done, whatever it is that you need the sunlight for. Today is a good day for that. And so we're happy to have you on. As usual, we are in for a very informative, very relevant, and very impacting show. As you know, Health Vibes, we really break down everything to your level. Information is power, and we really want to give you objective information that is going to not just enhance your general health and wellness, but empower you to make better lifestyle choices. Just reminding you again, our time is drawing nearer to our first ever sex symposium. The buzz is still in the air. I think, I suspect, Trudy, our venue might be small,
Too small.
It's like everybody's bringing, as we would say, Apache.
Bringing
people.
Apache people.
Everybody, bringing, so it's like many of the ladies are saying it's their girls' night out. They're bringing their girls, and so we expecting a bumper crowd on that night, and we're talking about February the 13th. The 15th, that is the day just before Valentine's Day. I'm going to tell you who our panelists includes, and these are people that we selected quite well, because we wanted people that is no holds barred, that is straight to the point, and at the same time, people who are knowledgeable on the subject matter. And we're going to be looking at all different aspects relating to sex and sexuality and matters relating to our sex life. When we talk about our sex life, we are really talking about our reproductive life, health, sexual related reproductive aspect of our life. And so, Trudy.
Yes, Carlton, before you drop the big news, because I know people have been waiting to know who do we have on the 13th at the Sex Symposium. Let me just say good morning to our listeners. Good morning to the Health Vibes crew, and good morning to those people who are constantly listening. I want to say good morning to a special lady I met yesterday at Jolly's Pharmacy, who said that she listens to Health Vibes all the time when she's in her garden on her radio, and this program is her favorite. She always tunes in. She didn't want to give me her name, but I want to say good morning to her. And I also want to say good morning to Lofty, who is, as you're leading into the Sex Symposium, who has indicated, that he's going to be there and is, very interested in this program, and he's encouraging other people to
Yes.
to come out as well. So good morning. So I've had two good pieces of feedback. One, really sex symposium and the interest there, and two, from a constant listener to Health Vibes who says we keep her company when she's in her garden. And I want to say good morning to people like her as well, who have Health Vibes locked on a Wednesday morning and allow us to be their company and their information source on a Wednesday morning.
Definitely, well said.
Mhm.
And truly, love to reach out to me so early and said, he would love to carry this live. And I said to him, we're not carrying it live. We want to make sure people are very, very comfortable with asking questions and so forth. So if you really want to be part of that, you need to be there. So we have a packed panel. And
Yes.
truly, you and I, we're coordinating on this.
Mhm.
So we have Mrs. Delia Coffee Weeks. We know that she's a social activist. She's a social worker by profession. Someone that is very straight to the point. Will say it as it is. She's going to be on. We have Dr. Shane McIntyre, who is an OBGYN,
Obstetrician gynecologist.
gynecologist.
Yes.
He's going to be on as well. So if you have questions relating to the female reproductive system, people have always asked, can a man penis kill the vagina? Things like that. How big is, kind of vagina take? And all kind of weird questions. We will be asking those kind of questions, and he will be able to answer these types of questions that you may have. I'm just giving you a little preview as to sort of things that will come up in that. We also have Dr. Ken Jacobs, who is our resident urologist on Island. And again, he's going to deal with matters relating to the male reproductive system, your premature ejaculation, impotence, and all these things, micro penis. There's so much talk about penis enlargement and feelings for the penis and things to make it, even the dominoes issue and all of that. So he will be able to deal with all these matters that you may have relating to that. We have my good friend and a big contributor to Health Vibes, Mr. Mervyn John Baptist. You've heard Mervyn many times when we've had discussions like this, on the radio. Mervyn is a social activist. He's a person that seemed to be very versed in many areas. And so we wanted somebody that's kind of a lay person, an ordinary person to be part on the panel. So Mervyn John Baptist is going to be on that panel as well. And we have Mr. Lester Guy, who is a health psychologist, the former coordinator for the HIV AIDS unit, and now the director of the gender unit of the Ministry of Gender Affairs. So Lester is going to be on to deal with the psychosocial aspect of sex and all of that. And he comes with a wealth of information as well. So we really have a good panel. You might be wondering, who are these people that are going to be talking? So these are the people that's going to be really talking. Trudy and I will be moderating. We'll be asking the questions. Of course, you in the audience will get the opportunity to ask questions as well. And we'll have some special treats as well there. We ask you to walk with some money, not to pay to enter, but there might be some things that you might want to buy as well at that symposium.
Yes, so Carlton, definitely a packed panel, a well-rounded panel, a male dominant panel. I noticed we have quite a few male
Yes.
professionals on the panel, and so I think it will be interesting, definitely, as it relates to the interactive nature that we hope to achieve. I know that these people who you have here are not shy to engage and to take questions and so on. So I think everybody that can should make the effort to turn out on the 13th at the UE Global Campus at 6:30 p.m.
6:30
right
p.m.
for the sex symposium. It promises to be very educational, but very I would say eye-opening as well, and very I would say thought-provoking. That's just based on the lineup that we have here. I think that there'll be a lot of interesting, thought-provoking matters that will be discussed here.
Definitely. All right, so we have a very special guest this morning, and we are so happy to have this individual with us today. It wasn't easy getting her across. I know Trudy tried from since last year. Trudy has been trying.
No, that's not true. Elas,
That's from last
I
year?
only started this year to try.
But we've succeeded. So what we're going to do, we're going to take a short break, and then Trudy is going to introduce our guest this morning and our specific topic.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Introducing Jolly's Pharmacy, brand new website, www.jollies.tm. It's your time to jump the line. Shop now at jollies.tm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.tm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.tm. Jollies Pharmacy, leading the way in healthcare.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. And that is JP Mega. Your one-stop shopping, Dominica, nigga. You could be shopping and having fun with your daughter or with your son. We cater to everyone. What a happy place. Oh, JP Mega. Your one-stop shopping, Dominica, nigga. You could be shopping and having fun. Bring Papa and Mama along. We cater to everyone. What a happy place.
Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
And we are back with you, of course. As Carlton promised before we went on break, we do have a very special guest in studio this morning. When we started off 2025, we spoke about some topics that we would like to discuss, some professionals that we would like to see on Health Vibes. Of course, our audience made their suggestions. But one of the topics that was, noted as something that we should really discuss are some issues as it relates to our cardiovascular health, vascular health in particular. And we do have a vascular surgeon in the house, angiologist, and her name is Dr. Alison Abel Seaman. She says, if you say Dr. Seaman, people mightn't know, but Dr. Abel, they might know.
Yes.
She is a specialist in the vascular system, of course, blood vessels for explanation, but she'll explain more. And she's a classmate of mine. So I want to put that out there that Dr. Abel and I were in high school together, and in that famous science class of 4A and then 5A at the convent high school. So we're science colleagues from back in the day, and she's joining us here on Health Vibes after Carlton said after asking for a long time. But no, she willingly came after a few hours. Dr. Abel Seaman, good morning to you.
Good morning, Trudy. Good morning, Mr. Carlton.
Good morning
Thank
to
you for
you.
having me on your show, Health Vibes.
Definitely.
And good morning to your listening audience.
Yes, so we've been waiting to have this particular type of discussion, some of the things that people maybe are not so familiar with or understand too well. And so doctor, tell us for what's your specialty about? What does it entail? I said vascular surgeon, angiologist,
Mhm.
but people may be wondering, but what exactly does she do?
Yeah.
What exactly do I need to see her for? So let us know what it is that your specialty entails.
Okay, so angiology, I did, and I graduated in 2023 in Cuba. Um, it's the study of the blood vessels. A lot of people will say they have circulation issues when they come to me, and I would ask them which circulation. They don't know because they were just told that they have circulation
Yes.
issues. When we talk about circulation, we talk about the veins and the artery. So angiology is the study of the different pathologies of the veins, the arteries, and the lymphatic tissues. And vascular surgery would mean that I am able to operate on these vascular issues.
Okay. So quite I would say broad area, because you do hear a lot of people talk about circulation. I have poor circulation, or I have some vein issue, or I have, or people will tell you I have something wrong with my veins or something like that, like something like that. So it seems that from your specialty, you can deal with quite a few complaints that people
Definitely.
may have.
So on the vascular or angiology, we have arterial diseases,
Mhm.
PAD, aneurysms, embolisms, thromboangiitis as well.
Okay.
On the venous component, we will see patients who suffer from varicose veins,
Mhm.
patients with DVT, or the famous blood clot,
Okay.
as we call it. And also in the lymphatic issues, we'll have persons with elephantitis. That is because of the blockage of the lymphatic fluid through the extremity. And of course, we have diabetic foot. This
Okay.
is under my specialty as well.
Okay. And what do you? My interest is, what do you see a lot locally? Like, what issue is very prevalent in so far in your practice?
So far, what I have seen, a lot of venous insufficiencies.
Okay.
It is most common because we have a lot of people who do constant standing throughout the day. The hairdressers, the barbers,
Cashiers,
policemen,
maybe.
teachers, healthcare workers. Anybody who does a lot of standing, they will complain eventually of a heavy sensation in their lower extremities, in their legs, swelling, pain, cramping, the hyperpigmentation or the darkening of the pigmentation to their lower extremities. So that is in effect is the most common pathology I have seen so far. And following that, we have diabetic foot. as
Okay.
well.
So
Quite
that's common.
Yeah.
Okay. I've seen you share some very alarming pictures of the diabetic foot.
Yes,
And
if you're on my WhatsApp, you will see a lot of post pictures.
Yeah.
Pre and post pictures of my diabetic foot patients.
Wow. Yeah.
Well, Doctor, again, it's really a pleasure to have you on this morning. This is somewhat new to the Dominica market in terms of health accessibility and speciality. And so we're very happy to have a vascular surgeon on Dominica. We know generally the general surgeon would have been the one to intervene in a situation like that. I would assume that you play a vital role even in accidents. There might be a traumatic situation, and then where a vein or an artery is severed, and you would have to be called in to assist. Yes, to repair, to assist. In reference to CNCDs, which is a major debate or issue affecting populace, how does our lifestyle interferes with some of the conditions that you've had to deal with or you've identified in Dominica? So we're going to start with that in terms of some of the CNCDs that are related or can cause major complications whereby patients may have to see you.
Okay. So that's a big umbrella question. That's a very big umbrella. We can divide it into the arterial aspect and the venous aspect as well. With the arterial aspect, we will mostly see patients with peripheral arterial disease, or What does that mean? It means that the blood flow through the arteries is not flowing sufficiently to provide oxygen and nutrient to that part of the extremity because of the formation of plaques, so atherosclerosis. Okay, and the number one risk factor of this peripheral arterial disease, we have high blood pressure, we have diabetes. So the non-communicable diseases, they affect us. They affect the lower extremities, they affect the flow of blood. And this is a very high component in Dominica as well. Our lifestyle, the things that we eat. Okay? So yes. In terms of the venous insufficiency, we, as I mentioned earlier, the constant standing that we do, especially the women, they wake up from early morning to prepare the household through the entire day on their feet, and then back at home again to end their day to make the preparations for the next day, always on their feet. So in effect, these persons, they will have the venous insufficiency. What we have to try to do is to keep the legs elevated as often as possible and to wear compressive stockings. Okay?
What role does hyperlipidemia, high cholesterol? Because even yesterday I was saying to one of my colleagues that over the past 2 years we've seen a huge spike of statins
Being
used,
prescribed.
and we're seeing high doses. If you're using Crestor, Zocor, the doses are very high. And that concerns me. It means that we really have some major problem with cholesterol in Dominica,
Yeah.
which relates to heart disease. So what role does in you've mentioned diabetes, high blood pressure, but high cholesterol?
High cholesterol is in fact a risk factor for peripheral arterial disease, okay? And it can be hereditary. Can be passed on from generation to generation, as well that it can be contributed to what we eat, the foods we eat. Now we have different cholesterols. We have the LDH, the LDL, low density, the high density, and the very low density lipids. Now, in the bloodstream, if you have an increase in the cholesterol levels, especially the low density lipids, these low density lipids, they tend to flow lower or closer to the intimal part of the artery, and thereby being able to stick
Adhere to it.
or
Okay.
adhere to it. And when this adhesion proliferates, you have a plaque formation. And this plaque formation, it grows and grows and grows until you may cause occlusion.
Blockage of the okay.
It can also break. It can also break and cause an emboli.
I like that explanation for the
Yes.
LDL, because I know it's supposed to be bad cholesterol. We say LDL bad, but I didn't understand why it was the bad
Yes.
one. So the way it, how low it flows and the adhesion to the vessel wall. That's I think that's very interesting, because sometimes you get blood results. If you do a cholesterol test, you see LDL, HDL,
total
VLDL,
cholesterol.
and you're wondering, what do these different things mean, and so on. So I like that that explanation. Doctor, we also, in addition to this area that we are speaking about, another thing that I know that you mentioned that you deal with, a lot of people talk about blood clots. And as a matter of fact, it's carnival season. People will remember the Hunter's song,
Yes.
blood clot in Calypso. Even so, to show you how much of an issue it is locally, it has even made its way into song, into Calypso song. What are you seeing in that regard? And when people say a blood clot kills somebody, or they had blood clots, what exactly does that mean? And can you put a little clarity to that when people talk about blood clots? What is that, or what causes that?
Definitely, truly. So we're going to be here for almost 2 hours talking
just about blood clots.
Okay, so blood clot embolism. It is the blockage of the blood vessels
Mhm.
caused by a foreign body or an emboli. This blood clot travels through the vessels
Mhm.
and it will travel until it reaches a smaller vessel and totally occludes or partially occludes that vessel, thereby preventing the flow to and from that vessel.
Mhm.
Now, this emboli or foreign body can be classified as cardiac and non-cardiac. So
Okay.
there are different causes.
Okay.
Okay. When we talk about cardiac, it's because the person's heart is not well
Mhm.
because of AFib, irregular heartbeat,
Mhm.
because of valvulopathy, the valves are not functioning as well,
Mhm.
because of a tumor in the heart, because of an open cardiac surgery, or because of a heart attack.
Okay.
So these are the cardiac component that causes a blood clot.
Okay.
Now we have the venous component and the arterial component as well. Okay, the venous component is what we normally call the blood clot, where you hear everybody talking about, oh, she went to the hospital, she had a blood clot.
Mhm.
These is the most frequent that we have in Dominica.
Mhm.
Now, there are other causes of emboli. For example, we have a fat emboli. We have amniotic fluid emboli that we see in
Pregnant women.
Yes, and we have foreign body emboli. For example, a gunshot or pellet may enter the bloodstream and it can flow throughout that bloodstream and cause an emboli. Okay, so we have a whole group of causes of emboli.
Emboli. Okay.
So let me ask
Now,
you, okay, quickly. So in reference to the pulmonary, so people will say that there is a blood clot in my lungs. Is that different, or is that the blood clot
It's the
gets
same
to the
thing.
lung?
It's the same thing. It's what the blood clot starts
Somewhere.
and so it starts somewhere,
Mm-hmm.
and the venous blood clot is usually what travels to the lung.
Okay.
Okay.
I get you.
So it has to start somewhere else.
Okay.
It has to start somewhere else through the vein, through the deep veins,
Mhm.
because the venous system is classified through superficial and deep. So when we say blood clot, we talk about the deep venous system.
Okay. So what would predispose someone to forming clots in their veins? So the venous causes that you just mentioned. What would, because for the cardiac you spoke about what issues the heart could have, but for the venous ones, those forming in the veins, those clots forming in the veins, and what could predispose someone to that formation of clots?
Yeah. Okay, so we have a triad called the virtuous triad. Okay, and there are 3 components of that virtuous triad, and each component has multiple causes
Wow.
of that formation of a clot.
Okay.
So the first, we can say stasis or stagnancy of the blood. That is as a result of an immobility
Okay.
or an unusual bed rest. So you will see persons with a fracture, they have a cast, they're not moving as much, and that causes a stasis or the slowing down of the blood flow in
Okay.
the veins.
Is that also, doctor, like if someone is on a long flight or something
On a
and they
long
say
flight.
you can get a
Yes.
blood clot?
Yes.
That's stasis. Okay.
Yeah, that's stasis. Okay. Then number 2, we have hypercoagulability,
Okay.
meaning that the consistency of the blood is thickened. Okay, and that may be as a result of multiple factors as well. There's a genetic component that could affect you and cause you, because of some deficiency of an enzyme that doesn't allow the blood to be thin, it can cause you to have a hypercoagulable state.
Okay.
We have persons, especially the young ladies who are on oral, who are on anticonceptive, that can cause the blood to thicken as
Okay.
well.
So you mean birth control?
Oral contraceptives,
Control,
okay.
the birth control.
Mm.
And we also have, for the third point, we have the endothelial injury, or when there is damage to that blood vessel from trauma as well.
Can the damage to the blood vessel be from hypertension as well? No?
It will more affect the arteries.
The arteries, not the
than
veins.
veins.
Okay.
Than
All
the
right.
veins.
So it's either the factors, well, the three, and you say those three also now have multiple things that can cause them. But
I failed to mention, I failed to mention in the hypocoagulable state, cancer is one. Cancer is one of them.
Okay.
And the early stages of cancer, DVT may appear. Even before the cancer markers are picked up before any blood test, the DVT is a sign that something is happening. So I'm not saying that all patients who have DVT has cancer. You have to rule out all the risk factors of that patient before you go further.
Because I was going to ask you if it's a specific cancer or for all cancers.
For all cancers.
Okay.
For all. Breast cancer, colon cancer, prostate cancers. It can. It can, because there's a change at a molecular level of the blood consistency.
Okay, so that's interesting.
Very interesting. I
And
know some of you might be saying some of the terms, it might be a little difficult to understand. We'll try to really break it down for you as the best that we can.
Right.
But let me just give you the numbers, just in case you may want to ask a question before it slips your mind. The numbers are 449-3095, 449-3096, 449-3097, 616-4257. And of course, you are welcome to join us if you reside outside of Dominica. That number is 305-432-9624. These are the numbers if you want to ask any question to the expert, Dr. Abel, who is a vascular surgeon and angiologist. You may have issues relating to blood clots, Baker's cyst. You may have something to do with a deep vein thrombosis. So you may have something to do with poor circulation of in the legs, or you may have a chronic ulcer that you've been battling with, maybe because you're diabetic or you have sickle cell anemia, or you have some other underlying medical condition and you want to ask a question. Feel free to do so, as she is available. And I see that we have a caller already on the line.
Hello.
Yes, good morning to you. Good morning. I know this voice.
Good morning, Judy.
Good morning.
Good morning, Dr. Eber.
Good morning. Good morning.
Vivadni, Dr. Eber.
Hi, Vivadni.
Well, I'm listening to you.
Okay.
Good information.
Thank you.
Which I am so happy with. My spirit coaches in what the help fear.
Yeah.
When Mr. Kasani invited you to give that health talk at Maui.
Yes.
And my spirit just caught you. Okay? And I said, okay, I have to visit you. I have to. And Carlton knows my problem.
Yes.
And the explanation you give me, Dr. Ever, you put my heart in place. The joy I have when I come to see you. And I got the what you recommended from my doctor yesterday.
Okay, very good. Very good, very good.
You okay?
So I'll see you again soon.
I come to you in 2 weeks' time.
Okay.
Waiting, but I am very, very happy with you and your explanation. I'm listening to you because, as you know, Carlton, this is my problem.
I know.
You okay?
Yes.
You know, I think I went to the best food and I'm in the best hands, Carlton. I feel so good about you, Dr.
I know that.
And I see you in 2 weeks' time.
Okay.
Right. Yeah. Take care, my friend.
Okay.
Have a good day.
I am listening.
Okay.
Definitely. All
take
right.
it.
So this is one
Yes.
this is someone, a
A
patient of
patient,
yours who's
yes.
Yes.
endorsing your work.
Yes. But
Mhm.
yeah, so we're talking about the blood clots, and doctor, you to just recap, you gave the three areas that could cause those clots. You spoke about stasis, so being stagnant, being
Mhm.
not moving,
Mhm.
and the some of the factors people could have for them to not move. They have a fractured limb, whatever it is. Or the second one you said is the hypocoagulation, so the clotting nature of the blood. You said that it could be genetic, there could be other reasons. And then you mentioned any sort of injury to the lining of the vessel.
Vessel.
So, that being said, these are the three areas. Okay, fine. So, somebody now that is possibly predisposed to clots, they maybe have some sort of genetic predisposition, and as you said, the blood is clotting more than it should. How would they know, or what are the signs then that you have clotting going on? How would somebody know? Because a lot of times people talk about blood clots in a very it's a shock sort of factor for them, when they find out or somebody passed away because there was a clot. So it always seems to
Surprise.
surprise people, right? But are there any signs or any sort of I want to say signs or symptoms, but yes, of blood clots that people can look
Can
for?
look out for.
Yes.
Okay. So the signs of DVT, this person may experience pain in that lower extremity. They may experience swelling in that lower extremity as well, difficulty walking, and they will have an increased heart rate, tachycardia. Now, this all depends on how big that clot is and the blockage it causes to that blood vessels. Okay. Also, you may have patients who may have a superficial blood clot in the vein, that is with the superficial veins in the leg. And that person may experience a warmth, tenderness, and they can actually feel that firm sensation just underneath the skin. That is what we call a thrombophlebitis. Okay, so these are the signs that a person may experience with DVT.
Okay.
Blood clot.
I see our lines are going. We should give our
Yes.
callers a chance to engage. Let's take this call.
Good morning to you, caller. Thanks for calling.
Good morning, Doc. Good morning.
Good morning to you, sir.
How you doing, sir?
We're doing quite well here.
I just joined in. I just come to your station, to your program.
Well, we're happy that you've joined.
Yeah. So Doc, I have a problem my own self. Since from the week, not from the week. The every time I suffer with this arthritis in my left foot. What can be done to cure arthritis? Sir?
Okay, but I know she'll be able to, and she'll be able to, but she's a specialist. So we basically dealing with matters relating to the blood vessels, issues with blood clots, because that's her speciality. Okay, the caller has gone. I know you'll be able to answer, but let's
But
take this other
we
caller.
have another
Mhm.
caller. Okay, we lost that
Yes.
caller, but caller, feel free to try again. We are, engaging with Dr. Abel Seaman, and for people who are just joining, she is a vascular surgeon, angiologist, so she's dealing with issues relating to blood vessels. We've been discussing blood clots, and so this is where we are. We have the caller back. Let's take that call.
Good morning to you, caller. Thanks for calling.
Yeah, Doc, I'm the same caller that called a while ago.
Yes.
So I was saying I suffer with my left foot, my ankle rule that was hurting me every time the weather is cold. And I went to doctors already. They tell me arthritis are doing that. So what is the medicine for arthritis already?
All right,
What
but
has to be done?
yeah, we will answer you. And I mean, most doctors would give what we call an NSAID, a non-steroidal anti-inflammatory drug for arthritis. They may recommend as well certain minerals and vitamins that's going to help you. Although with the NSAIDs, so things like diclofenac, Voltaren, indomethacin, piroxicam, these types of drugs, they are normally given for a period of time, and then you would have evaluation. We also take precaution in terms of your stomach. So then the doctor may give you another drug to protect your stomach against the side effects from the NSAID. So this is, I mean, it depends on the type of arthritis that you have, because there are over 200 different types of arthritis. So it depends on the type of arthritis that you were diagnosed with. That will determine the type of treatment that you're given. Okay.
What must I do to get treatment? Where must I get the treatment now? What must I do
You
to get
just speak to your doctor. If you go to one of the health centers, if you access primary health care, you go to one of the health centers. I'm sure one of the doctors would be able to recommend one of these medicines that I've spoken about for you.
Okay.
Okay. And with arthritis, it is very common during the chilly, cold weather for you to feel more pain and discomfort or even stiffness. So it's just a matter of maybe using a rub, maybe a heat rub or something like that, that might be able to help you, flexing the muscle, the joint. That is going to help as well.
Okay, because I went to the doctor and they gave me a cream, but the cream, I know the cream is not working. The cream is not
Yes.
kind of working.
So just let the doctor know. Paracetamol is not really going to help you, but as I said, we have the doctor that's here is focused on a specific topic. So you can visit your general practitioner and have that discussion if that's okay. All right. Have a good morning. Take care. We have another caller online. Good morning to you, caller. Thanks for calling.
Morning, Carlton. Good morning.
Good morning to you.
Special
Morning.
good morning to my doctor, Dr. Alison Abel Simon.
Nice.
Alice the Irish Esquire, right here.
Good morning.
Dr. Abel, trust me, she's everything. Trust me, everything in the world is Dr. Abel. I can't say nothing. Because when I have lost hope, she bring back hope.
Thank
I just
you.
wanted to know well, yeah. See you soon. Bye-bye.
Thank you. Okay, bye.
Thank you, Alice, the Irish Esquire, giving his commendations there to Dr. Abel Simon. That's good. So yes, Doc, we were discussing. We started off with the whole discussion of what you do, and we went into the blood clots aspect. I know there's some other areas we need to touch. I see though we have another caller.
My phone is going busy.
Yes, let's
People are
let's
asking
take this
questions.
call. Caller, good morning.
Yes, good morning, Carlton. How are you?
I'm doing quite well. Good morning to you, caller.
I'd like to say good morning to my doctor, Dr. Abel. I just wanted to explain more for me because I have a bit of it at the back of my knee. To give me a little more explanation, please. Thanks.
Regarding the Baker's cyst. Okay.
Okay, so the Baker's cyst is just it's a small formation of fluid at the back of your knee, and it can grow. Okay, and in some persons, it may cause a compression and pain to that area, to the popliteal region. It can be treated with injection or retraction of fluid or removal of the cyst as well. So it all depends on the size of the cyst and the symptoms that the patient presents. Okay? Yeah.
Okay. All right.
Dr. Abel, I just wanted to ask you in reference to aneurysms. We know that it is considered a medical emergency. It can be quite fatal, and it is often asymptomatic in most cases. When you do get a terrible headache, you might just fall to the floor. It is one of the medical conditions that many people are not aware of or may not know about. I don't know if you want to highlight this area because that's one of your areas too.
So aneurysms, the dilation, unusual dilation of an artery.
So when you say dilation, just break that down for our listeners.
It's opening.
Describe it like a balloon.
Yes,
Start
like
to
a balloon.
balloon.
Now we have to understand it's only found in the arteries. The veins do not have aneurysm.
Okay.
The veins get dilated.
Yes.
But the arteries have that balloon shape aneurysm. Why? Our arteries have 3 walls. Okay? Or the layer, I should say, should be divided into 3. We have the intimal part, we have the medial part, and we have the external part. The medial part is the most important because it is made of elastic muscle. And this is what helps with the pulsation of the blood flow throughout that vessels. So if the medial part is weakened for whatever reason it may be, because of the person suffering from some syndrome, and the collagen is weakened because of some trauma, because of infections. It can weaken the walls of the middle layer of that artery. So when that middle layer is weakened and you have that constant pulsations going on there for years and associated with high blood pressure, this area is going to start to dilate and dilate and dilate until it gets to a point where it can leak out or it can burst. Okay. Now, as Mr. Carlton said, it usually goes unnoticed until it is too late and complicated. Okay, especially the abdominal aneurysms. In the brain aneurysms, you may find persons complaining of headache, dizziness, visual changes, blurred vision, double vision. So they tend to go to the doctor. The abdominal aneurysms, they tend to go unnoticed until it bursts out and the blood is collecting and it commences with a severe back pain, difficulty passing urine, difficulty walking. And it is usually on an incidental finding. For example, somebody may go to get an ultrasound because they have gallstones or to check their womb, they have fibroids. And then the radiologist may report incidental finding, abdominal aneurysm. So it is usually unnoticed or asymptomatic until it ruptures.
Wow, this is I never even knew of that particular condition. So this is new to me. And so what actually causes this one?
As I said earlier, it's the weakening of the arterial wall. And that constant pressure, especially if you're hypertensive and you're a smoker, it will cause that area to dilate like a balloon. It's also hereditary. So somebody's brother, mother may have it. You should check yourself as well. It's hereditary.
I see we have another call. Let's take this caller.
Listen,
yes,
all right, just give you the numbers again: 4493095, 4493096, 4493097, 6164257.
Yes, doctor, I wanted to continue in line with the aneurysm topic that just came up. I think we're getting the call back.
The caller is back. I think it was next line. Yes. Good. Oh, we don't know. Okay.
Yes. The major artery, the aorta, which leaves the heart. So sometimes you hear someone say, someone had an aortic aneurysm, which would be fatal. This particular blood vessel, this major blood vessel that everybody knows is the big one. What would cause the aorta to not? I mean, you've already explained what causes the aneurysm, the weakening of the wall, but for the aorta specifically, that's such a big vessel, that's such a a major vessel. Would somebody spontaneously have a ruptured aortic aneurysm and have no previous signs, symptoms, nothing like that?
Definitely.
Wow.
Definitely.
Wow.
Especially if the person has high blood pressure associated, a smoker with peripheral arterial disease or atherosclerosis among that aorta, it can happen.
Okay.
It can happen.
I thought for such a major vessel there would be some sort of sign or no. Wow. And one last thing. So I know there's also, I don't know if it's available here, but I remember seeing years ago at Ross University, I guess it's called an angiogram, where you can trace the blood flow through the blood vessels and see if there are any out pockets or any aneurysms. Is this a diagnostic test that is available locally? Soon to be.
Yeah.
Okay. Because I remember being so amazed that you could see those aneurysms in advance by, passing that dye through the vessel and you can see the out pockets. So I said, boy, that could you really save someone if they see the aneurysm in advance. Although, doctor, now let me ask this follow-up. Now I'm getting interested now in this. So if I do the angiogram, you said soon to come.
However, the ultrasound is 99% conclusive.
Okay, so an ultrasound would also show you.
Yeah.
But if I do an ultrasound and I see the patient has this aneurysm, what can be done to fix it?
So it depends on the size of the aneurysm and how fast it is growing. So if the aneurysm reaches up to 6 centimeters, okay, then that person has criteria for operation.
Okay.
However, if it is at a size of 3-4 centimeters, it is conservative treatment. You manage your risk factors, you manage your diabetes, you manage the high blood pressure, you manage the smoking, or you should stop smoking, your diet, okay? And you monitor or you repeat ultrasounds routinely to see the growth,
the progress,
the progression of that aneurysm.
Okay. Okay.
Dr. Abel, I want to switch gears a little and focus a little on wound care, because it's a big area. I'm seeing newer prescriptions for newer products. Products that we have to source. Sometimes we've never even heard of these types of dressings now that are being prescribed by yourself and some other doctors. And before time, many of the antiseptic agents were used. The iodine, the hydrogen peroxide, the Savlon, those things were used. And now science have said they should not be used in most of these chronic cases, particularly everyday use.
Yeah.
So talk us a little about how do you identify a chronic wound, and the things that people should know about wound care, at least from a summarical perspective.
So wound care, again, is another umbrella topic. It all depends on the etiology or the cause of that wound. It can be arterial, venous, or from diabetes. So each of these etiologies has a different form of management. It will not be the same way I would treat an arterial ulcer as to a venous ulcer. The arterial ulcers can be very painful and they have to remain dry. So you do dry dressing for these ulcers to avoid infection. Whereas the diabetic and the venous ulcer, you may want to have it a bit moist so that it can help with the proliferation of the tissues, okay, and for closure of that wound.
I see we have a caller. Yes, let's take this call.
Pleasant good morning to you, caller. Caller, good morning.
Carlton.
Yes, good morning.
Very good question, Carlton. Very good. Very good question. And then check your WhatsApp. I sent you a picture of that wound and things that Dr. Abel recommended for me.
Okay.
And my daughter sent it yesterday.
Okay, I'll check it out.
Check your WhatsApp when you're done.
Yes.
A very good question.
Thank you. Thank you. Because I'm glad that you said that, doctor, the different etiology or causes, because someone may have a wound at home, and especially men, I've seen that. And they cover it up, they wear long pants all the time, and they come to the pharmacy, they buy gauze, they buy, all the different things, and they dress it on their own, and they buy in the triple antibiotic and all of that, and they treat it on their own. And we've seen that.
Yeah.
And sometimes when you don't hear the shot, the person has an amputation. So now we're talking about the different wounds, what is causing the wound, and that determines the type of treatment
that the patient needs.
that is needed.
So they have to treat the foundation of these wounds, their risk factors. For example, someone who has arterial insufficiency, peripheral arterial disease, they tend to have painful sores to the tip of their foot, to the dorsum of their foot. Okay? Now, even if you treat that wound externally, if you are not internally doing what you're supposed to do in terms of your diet, your medication, cilostazol, aspirin, whatever it is that you should be taking for your their basic medication. If you are not taking it consistently, then that will difficult or slow down the process of that wound. The venous ulcers as well. The venous insufficiency is as a result of the veins not pushing up the blood efficiently to the heart. Okay, so persons who do a lot of standing, as I mentioned earlier, we have the teachers, we have the hairdressers, we have the barbers. When you're constantly standing, these veins has to push up that blood through your heart, to your heart. Okay, now the pull of gravity pulls down, your weight pulls down, the constant standing pulls down. So you have basically three forces against that vein trying to push up that blood. So this is going to slow down the return of the blood to the heart. And as a result, these veins are going to become varicose or dilated. And this dilation now is blood which is full of carbon dioxide and waste materials. Okay, so when this blood pulls carbon dioxide, waste materials, it's going to eventually break down that skin, causing an ulcer. You will see skin changes, the darkness, the hypopigmentation, dry skin, itching skin. All this is because of the venous insufficiency, the inability of the veins to return the blood to the heart.
Wow.
So if that patient is not monitoring or treating that their risk factors, avoid being on your feet for a long period of time, avoid sitting for a long period of times. They are not wearing the compression stockings as they should. And the time you need the compression stocking is when you have an ulcer. Some patients, I know she's listening, she just called a while ago. She said that it can be painful, but that is when you need it the most, the compression stockings. It helps with the flow of blood. It helps with the flow of blood. So when you don't adhere to the risk factors or you don't treat the risk factors, whatever, you can clean it every day externally, but if internally it is not treated, then you will have the ulcers not healing.
Wow. Very interesting. Good morning to you, caller. Thanks for calling. Caller, good morning.
Good morning, Fireman Touching Base. Good morning to Rivernick and the world.
Good morning to you.
Good morning to the Kingman and the Empresses now, I have to say. Now we're talking health. Health. When you're healthy, you're wealthy. Now, really and truly, now I know whole heap of things, all speaking about making a lot of sense. But what I trying to find out to myself now, all these problems there, what are causing this problem? And I really doctor when you're an Empress and next side saying that smoking. I want to know what type of smoking are you talking about? And he's smoking because to me, really and truly, I realize what's happening in our world right now. You see this flesh we eat in there. That is one of our biggest problems, really and truly. Because really and truly, most of the things the people eating them now, they're not looking like these natural things people are creating. So that must be a problem in human being bodies. Now watch it well. A lot of people are even using vegetables or like bits. People say as bits, and this is very healthy for human beings. You know what I'm saying? Don't put on blood and things. Now a lot of women really and truly have fibroids, as they call it. This thing, as I say again, is the same meat eating. Too much of flesh in your body already, of flesh already. Now, we eat a lot of acidic food. So acidic now is a place for sickness. So right now, the people need to get more alkaline. You know what I'm saying? I can tell me anything, but anyhow, health is important.
Right.
Eat healthy, stay positive, love life.
Thank you.
And running, fireman running, bless God.
Thank you, caller. Thank you. Thank you, caller. Dr. Abel, I'm very intrigued, particularly regarding the wound management. There are people who are embarrassed about the wound and may not be willing to seek health intervention from an expert or maybe the wound has a smell, so you have maybe necrosis happening, or just the stigma, and they feel maybe it's like almost like an embarrassment, and they withhold. They decide that they can do it on their own. What do you say to people who are in this situation?
Don't be afraid, I am here. Okay, they should not be afraid. Nobody calls to be sick. Nobody wants to be sick. Okay, especially the diabetic persons. However, you manage your risk factors. You manage your illness, your base illness. Okay, so especially venous ulcers, people suffer with venous ulcers for years. It's chronic. You may have persons with venous ulcer for 10, 20, 30 years going. Okay, and they are indeed ashamed of going to the healthcare professionals because of, as you said earlier, their smell, the smell of it. This does not bother me. This not. I am here to help. Okay, so anybody who's willing to come to me to clinic, I do clinics on Mondays at the hospital, or if they want to see me privately, that can be done as well.
Doctor, I wanted to ask you another question regarding wounds. And it's, in local term, we say have bad flesh. So somebody may have a wound, something cut them, and they finding it taking so long, and they're saying, well, they tell me my family have bad flesh. Talk a little about that, because that's a common thing we hear up to now. People say that it taking long and may not know sometimes that person is diabetic. That person may have one of the underlying medical conditions, and they're just assuming that they have bad
They
flesh.
have bad flesh, so that is why the wound is not closing. So for the venous insufficiency as well, it is because of the poor circulation to their food. So these individuals, they should get checked out. Okay, do ultrasounds, check the venous competency of the veins. Okay, and diabetes, HbA1cs. Know your family history, who's diabetic, who is hypertensive, and know if you're at risk of being hypertensive and diabetic as well, to know exactly what is the foundation and how we can move forward in treating your wound.
I wanted to shift gears a little. We've been talking about wounds and, possibly people thinking of the aesthetics of it. They don't like to, they're embarrassed. But another thing that, Doctor, I know you deal with that a lot of people may find not aesthetically pleasing. They don't like to see it and they're embarrassed about it, are those varicose veins. I want to know from you, what is the reason or what is the cause of those bulging veins that people will see and maybe be embarrassed about, especially ladies. Ladies are very self-conscious about those their legs and the appearance of those veins. What is the cause, and is there any remedy, so to speak, for that condition?
So varicose veins is the dilation of the superficial veins. The deep veins, they don't get varicose or dilated because they are found within the muscles of the legs. So the veins that lie below the skin, these are the superficial veins, and these are the veins that get weak. So as a result of the constant standing as well, in the tall persons, the persons on heavy side, these veins, as I said earlier, they have to push up the blood against these forces, the gravity, the constant standing, the weight. So eventually they dilate, they get elongated. Okay, no, this does not happen at once or over a year. It takes a period of years before you actually see them. So there are different grades as well. You have the very small spider veins, and you have the larger veins that look like snakes on the person's foot. In terms of treatment, we have a range of treatment: conservative management, where the patient will, one, avoid being on your feet for a long period of time, avoid sitting for a long period of time. If you realize that you're standing for a long period or sitting for a long period, you get up and you move about. You flex your foot to allow circulation to flow. At home, when you get home, or even in your office, try to elevate your leg on a stool to allow the flow of the blood to come up. Compression stocking, again, is part of conservative treatment to allow the flow to go up. Vitamins, vitamin C and folic acid, they help maintain the tone of the walls. Okay. However, once the wall has passed that elasticity, it does not go back to its normal size. It does not go back to its normal size. And there we have also Venaton is a new drug that I have been, or Jolly's have been sourcing for different patients. It's for vein health, and it helps with the circulation of the foot. It helps with the swelling, it helps with the hyperpigmentation, and it helps with the venous flow. It helps keep the wall toned to prevent that wall of the veins to get dilated. And in terms of surgical treatment, we have sclerotherapy, where the veins can be injected with a certain substance and it causes it to shrink. Okay. There's also laser therapy that can be used for the very small spider veins, especially where you can burn it off. And there is open surgery where you surgically remove, or venous stripping, as it is called, to remove the veins.
Wow.
But doctor, is there any risk to overall health from the varicose veins, or is it just a aesthetic issue? Meaning, would I be treating because it can cause some other complication for me, or would I be treating varicose veins just because of the appearance of it?
So the number one reason why females come to angiologists, they go to an angiologist, is because of the aesthetic reason.
The appearance.
They don't like to say, they cannot wear the short pants, they cannot wear the short skirts, the veins are bulging. Eventually, the varicose veins can cause complications.
Okay.
It can cause a thrombophlebitis, that is in the superficial vein, which I mentioned earlier. However, this thrombophlebitis can extend into a deep vein and cause a DVT, or blood clot. Okay? And these varicose veins, venous insufficiency, it can cause the complication of a venous ulcer in that leg.
Okay. So there are possible complications. Okay.
Most of the times, we recognize that these, whether it's deep vein thrombosis and spider veins, they seem to be more common in women than men. Is there a genetic correlation regarding this?
There is a genetic correlation. However, hormonal changes, pregnancy adds to it. So when a female young lady is pregnant, the first trimester, there is hormonal changes, and that can weaken the veins as well and make the spider veins appear. In the third trimester, the increased intra-abdominal pressure causes the veins. So you have that increased pressure, and the veins is having difficulty to push up that blood because of the upper body pressure, and it causes the veins to be varicose. So you'll tend to see it more in females than in men.
What about age, doctor?
Age is a factor as well. Age is a factor as well. The constant standing throughout the years, as you get older, in your 50s, your 60s, you tend to see them appear.
Okay.
In reference to your profession as well, would you normally have to deal with, let's say, a hemorrhoid? Because it's kind of vascular to some extent.
Yes. The hemorrhoid is a dilation of the vein in the rectum area, and normally you have the general surgeons treating the hemorrhoids, doing hemorrhoidectomy, surgical removing. But now there are new studies, and angiologists, vascular surgeons, are starting to take over the hemorrhoids with the injection of the sclerotherapy as well. Injected into the hemorrhoids.
That same therapy you mentioned for the varicose veins.
And is that available in Dominica?
Not right now.
Not right now. Okay.
Not right now.
I see we have someone trying to call in. Let's take this call.
Good morning to you, caller. Thanks for calling.
Hello, good morning. Where the doctor has her office?
Yes, so she'll give her information.
Mhm.
Yes, she'll give her information as to where she has office. Doctor, you can go ahead because we're
Yes.
actually just about to wrap
Right,
up in a
yes,
few minutes.
yes.
So we will give the information of how you can contact her. So doctor, let us know. Okay.
Yes.
So I am now opening my office in the corner of River Street and Kings Lane. It's number 8 River Street. I can be contacted at 285-9586.
Mhm. So that number again for Dr. Abel is 285-9586. So if you do need to see a vascular doctor, a doctor that deals with veins and arteries, issues relating to blood clots, issues relating to deep vein thrombosis, Baker's cyst, any of these types of conditions, then we do have a doctor in the house that will be able to take care of that particular need.
Diabetic foot, you mentioned
Diabetic
that.
foot
Yes,
as
the
well.
diabetic
Yes,
foot.
yes, that's important.
So she's able to deal with all of these things. Corner of River Street and Kings Lane is the location. And Carlton, you repeated the number.
Yes, I did.
285-9586. But Doctor, yes, we've had such an interesting discussion.
Very.
I see a lot of our online viewers are commenting that the information has been very good, very valuable, very informative. I see a lot of that coming in through the Facebook and YouTube pages. And I don't see any questions coming in, but I just see a lot of commendations for good information.
Yes.
So it seems that we had a very fruitful discussion here this morning, but I know there are people who maybe do have questions or do have issues that they want addressed, and of course the doctor has given her contact information that you could schedule an appointment and see her for those issues.
Well, we are just about out of time, and so we're going to give Dr. Abel some, an opportunity to just give some parting words, any encouragement to you or the listeners out there, as to what you can do to, be healthier and to prevent some of these medical conditions that she deals with. And if you do have these conditions, try to really make an appointment to see her.
Okay, thank you, Mr. Carlton. Number one factor, or most important factor, is to manage your risk factors: the high blood pressure, the diabetes, the smoking, the types of food that we eat. They are very, very important on the roles and the functioning of your blood vessels. Okay. Try to rest your legs as often as you can, as much as you can, to prevent venous insufficiency. Wear your compression dressing, vitamin C, folic acid. So these supplements are very important as well. I give all my patients folic acid and vitamin C because it helps with wound healing. It does. Okay. And my contact made available at the hospital as well. My clinics are on Mondays at the hospital. Okay, so thank you for having me. It was a pleasure. Maybe I can come in another time.
Definitely.
Yes, because there's so much to discuss.
Yes.
I mean, we try to touch on some of the, the areas that you deal with, but I do know that you deal with a lot that we did not even have an opportunity to get to. So definitely we are open to you returning to Health Vibes. I think, there are certain specialists, Carlton, we need to have them
Definitely.
as, on a retainer here
I agree.
at Health Vibes, because our listeners benefit so much from the information that they have to share. So you will always be welcome to come back to this program.
Thank
Definitely.
Thank you.
Again, from all of us here at the studios of QFM, it was a pleasure bringing to you Health Vibes, brought to you by Jolly's Pharmacy. As always, your health is indeed your greatest resource. Preserve it. Have a good morning, everybody, and take care of yourself. Until next week, I believe next week we should have, I think next week we should have the urologist from Antigua. I think he should be our guest next week. And so we want you to stay tuned, particularly all our men and the good women who take care of the men. We want you to listen as well next week. So we have, yes, Dr. Reef? Yes. Yes, from Antigua. Yes. So he should be our guest next week as we'll be talking about everything relating to the male reproductive system and the bladder. Take care, everybody. Until next week. Bye-bye.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning